Okay, quick show of hands. If you've ever stood in front of a doctor, maybe vulnerable, maybe in a paper gown that's doing approximately nothing, and had the doctor look right at you and essentially say, "Have you considered just being smaller?" Keep your hand up. Now keep your hand up if that doctor was wrong. Not just bedside manner wrong, medically, actually wrong. Yeah, that's what I thought.
You're listening to Unbound Off Script. No outlines, no safety nets, just Beth Curry talking about whatever the hell she wants, or whatever the hell you've asked her to uncover. It's unfiltered, it's unpredictable, and it's officially started. Pull up a chair.
Hey everyone, welcome back to Unbound Off Script. Another listener request for this one. Today we're talking about lipedema. It's a chronic progressive condition that affects an estimated 11% of women worldwide. It has been misdiagnosed, dismissed, and minimized for decades, largely because it tends to show up in fat women, and we live in a world that has historically decided fat women are the problem, not the condition. I'm going to get into the science, the symptoms, the treatments, the emotional wreckage, and because this is still unbound, the moments that are just genuinely darkly funny in retrospect. This episode was requested by Jacquie. And Jacquie, I have to tell you, the second I read your message, something in my chest just went, yes, this one, we need to talk about this one past a mention here or there, past episodes or seasons that I've done, because I have mentioned it. So, lipedema is a chronic disorder of fatty tissue. And I want to be precise here because it matters. It's not obesity, okay? It's not lymphedema. It is its own condition, and it just kind of happens to arrive wearing both of those as disguises, I guess. So what's actually happening in a lipedema body? Abnormal fat cells accumulate in specific areas, classically the hips, the thighs, the butt, and the lower legs, in a way that's symmetrical, disproportionate to the rest of the body, and resistant to diet and exercise. The tissue is often painful to the touch. It bruises easily, it swells, and over time, if untreated, it can progress to the point where mobility is significantly impaired. It almost exclusively affects women. It's strongly tied to hormonal changes, puberty, pregnancy, perimenopause, menopause. It has a significant genetic component, and it was first described in medical literature in 1940. 1940 at the Mayo Clinic, 80 some odd years ago. And yet here we are, recording a podcast episode about it because most people, including most doctors, still don't know what the hell it is. So let me tell you why that is. Sit down. Actually, you're probably already sitting, so stay seated. For most of the 20th century, medical research was predominantly conducted on male subjects, right? Women's health issues, especially ones that didn't involve reproduction or mortality, were systematically underfunded and understudied. Conditions that primarily affected women that caused chronic pain and disability, but not immediate death, were frequently filed under the heading of patient needs to try harder. Lipedema didn't get a formal ICD-10 diagnostic code in the United States until 2022, 4 years ago. Before that, there was literally no standardized billing code for it, which meant that even if a doctor knew what it was, the system had no real framework for treating it. Insurance had no obligation to cover it, and in Canada, they still don't, and patients had no vocabulary to demand care. This is a structural failing of epic proportions, if you ask me. I want to take a minute here and just, be a person with you. Most of you know my background. I grew up fat. Childhood, adolescence, adulthood, I was that girl, the one who was always a little too much of something, too big, too loud, too present. And I became very accustomed, in the way you become accustomed to things that are quietly breaking you, to being told that my body was the problem. So when I started having pain in my legs, real pain, the kind that made me not want to walk and the kind that made me dread a flight of stairs, the first place everyone's mind went to was, well, you're heavy. That's probably why. And I believed them. I'd been trained to believe them. So 26 years ago, in the year 2000, I went in for leg pain. The working theory was blood clots, which, to be fair, was a reasonable concern given my weight at the time. They did a vascular study. They put those little nodes on your calves, gels, ultrasound wands. You get the little printout. Looks like an EKG for your legs or something. And then I got referred to a vascular surgeon, and that surgeon, who I want to be clear was a perfectly fine person, looked at my test results and said essentially, it's not clots, it's lipedema. And then he moved on. No follow-up, no treatment plan, no here's what this means for your body, no here are the things you should know, just lipedema, not clots, have a nice life. And because I was a fat woman in the year 2000 who had been taught that my body was my fault, I filed that word away somewhere in the back of my brain and assumed it was just another item on the long list of things wrong with me, and my body was continuing to fail me. So for over a decade after that, I didn't know. I didn't know that the lumps in my legs, those tender, sore, nodular little mystery bumps, were lipedema tissue. I would push on them. I thought they were just tight knots in my muscles, and I would push on them, and then the pain would be excruciating, this tiny little pea-sized lump, and I'd be pushing on it, trying to release it, thinking it was a knot in a muscle, and I'd somehow, inexplicably, get this really sharp pain that felt like someone was sticking a needle in my upper back or something. So it was referred pain. I didn't know any of this. I didn't know the pain wasn't just weight. I didn't know because nobody told me, and I didn't know enough to ask. Now, can I just I think that's a story a lot of you know in some variation, right? The diagnosis that happened and then didn't happen, especially for women. The information that existed but wasn't given, and the decade of just kind of living inside its body that you didn't have a name for, right? Eventually I lost the weight, a significant amount of weight, actually, over 200 pounds. And I want to be careful here about how I say this because this is both personally true and medically important. When I lost that weight, my legs did not follow. At my lowest, I got down to 140 pounds. 140. I was training for a marathon, and after I ran the marathon, I knew that, that weight was not sustainable for me. So obviously I'm not 140 anymore. But my legs look like they belong to someone else. They shrunk down a little bit, but they still didn't look right. The regular fat, obviously with the weight loss, disappeared, but I still had all this lipedema fat. I couldn't explain it away, in a way that was undeniable. And then I had a hysterectomy, just the fallopian tubes, the uterus, not a full surgical menopause, but enough hormonal disruption to light a fire, and my legs exploded. That's the only word for it. Exploded. I hadn't changed a single thing about how I was eating or moving, right? Nothing. And suddenly I had legs that looked completely different from what they'd been 6 months before. That was the moment that lipedema stopped being a word filed in the back of my brain and became the word that kind of explained the last 20 years of my life. I learned, because I finally started researching, that major gynecological procedures are a known lipedema trigger. Hormonal shifts don't just affect mood and hot flashes. For people with lipedema, they can cause dramatic, rapid progression of the disease. My exercise was becoming more difficult. Life was becoming more difficult. I felt like I had cinder blocks strapped to my feet 24/7. I went back to my plastic surgeon. He was honest with me. I respect that. I really do. And he told me he wasn't fully trained in the specific liposuction technique used for lipedema treatment. He really didn't even know what lipedema was, to be honest. The specific liposuction technique used for lipedema is different from cosmetic lipo in some pretty important ways too, right? He did the procedure anyway, at my request, knowing my limitations. And even without the specialized technique, he restored my mobility. He gave me back the ability to walk without pain or cinder blocks. So I don't fault him for anything. I don't blame him for anything. I'd recommend him in a heartbeat for anything else. I'd go back to him for anything else. He worked with what he had and what I needed. And the result was meaningful. But it wasn't a cure because lipedema doesn't have one. So now I'm navigating perimenopause or menopause, not quite sure. The hormonal chaos that comes with, that transition predictably, cruelly, almost poetically triggered another flare. My legs are doing their thing again. I'm doing everything I'm supposed to, decongestive therapy, rebounding, vibration plate, compression, massage, constant movement. And it is, as I said to a friend recently, a losing battle delivered in increments. Travel is complicated now. Anything too hot, anything too long on a plane, anything too far, I'm looking at days or sometimes weeks of pain afterward, which for someone who loves to move through the world, who loves showing up places, it sucks donkey balls. That's my story, or the version of it I can give you today. So this episode came to me because of Jacquie. Jacquie reached out because her story has some important echoes of mine. A long life with obesity, which in a world that treats fat people the way our world does, it's not just a physical experience, it's a social one, a psychological one, a daily accumulation of small and large indignities. Okay, Jacquie lost a significant amount of weight and then she regained it. Now I want to stop there because in our culture, that story, the loss and the regain, gets told as a failure narrative, as a story about willpower or the lack of it, as evidence that the person didn't try hard enough or didn't want it enough or just made bad choices. But here's what we know about lipedema. The fat it produces is not responsive to caloric restriction or exercise in the ways regular adipose tissue is, right? It accumulates due to hormonal and lymphatic dysfunction. You can do everything right, everything, and lipedema tissue will do exactly what it wants. So if Jacquie or anyone who's listened lost weight and then regained it, and the regain was disproportionate, particularly in the lower body, and the tissue is painful and lumpy and swells in the heat, that's not necessarily you. That might be a medical condition. That is not the same thing as giving up, guys. Jacquie, I hear you, and I'm really glad you asked for this episode. I understand your diagnosis is relatively new. So I want to talk about what lipedema actually looks like in a body and how it progresses, because this is information that a lot of people with lipedema have never been clearly given. So lipedema is staged typically from stage 1 through stage 3, sometimes stage 4 when it progresses to lipolymphedema, which is a combination of lipedema and lymphedema together. So stage 1, the skin surface is still smooth, but the fat tissue underneath is enlarged and there may be nodules. You can feel like little lumps under the skin. Pain and easy bruising are common. Stage 2, the skin begins to have an uneven texture, sometimes described as mattress or walnut shell appearance, and doctors who have been calling lipedema obesity for so long would call this cellulite. I do want to make sure people understand there is a difference between it, but it looks very similar. So of course it's going to be called one thing, even if it's not the other. This is why investigation has to happen. The nodules are larger and more palpable than they were in stage 1. Stage 3, large lobules of tissue develop. Mobility can be affected. The skin changes become way more pronounced. And then stage 4, if it happens, is lipolymphedema. The lymphatic system is now involved because the sheer volume of lipedema tissue has compromised lymph drainage. And this is where significant swelling becomes constant. I'm between 3 and 4, actually. Lipedema typically affects the legs, but it can also affect the arms, usually from the shoulder to the wrist. My arms are affected now. Spares the hands, and less commonly other areas. The classic pattern is column-like or cuff-like distribution that stops at the ankle or the wrist. You can see it in people. And when you have lipedema, when you've finally been diagnosed, it's amazing how many people you can see who have it and may not even realize it. Anyway, the cuffing and stuff, the cuff sign, it's called the cuff sign. It's an abrupt stopping point, is actually one of the diagnostic indicators for this. Other hallmarks include pain that is disproportionate to touch, heaviness, easy bruising, swelling that worsens with heat and prolonged standing, and even just the sense that your lower body just doesn't belong with the rest of you. Something important that people don't really talk enough about is that the pain is real. It's not just a cosmetic condition. It is a painful, progressive disease. I have a very high pain tolerance, but when it's bad, it can be pretty bad. The psychological weight of carrying a condition that looks like something the world has already decided is your fault, that is its own layer of burden, and that is extremely well documented in lipedema research. Women with lipedema have significantly higher rates of depression and anxiety and eating disorders than the general population. Not because bigger women are inherently more mentally fragile, but because living for years or decades in a body you've been told is your fault and then finding out it wasn't does something to a person, for sure. So what can we actually do? Because, there's no cure, as I said. There's management, though. And management matters. Conservative therapy is the first line of treatment. It's where most people start. And honestly, where most people live most of the time. It includes complete decongestive therapy, CDT, the gold standard for lymphatic involvement. It combines manual lymphatic drainage. It's a specialized massage technique that moves lymph fluid through the system. Compression garments, those are of the devil. Exercise and skincare. This is what I'm doing right now. It doesn't fix lipedema tissue, but it manages the swelling and the pain. I'm never going to have beautiful legs ever in my life. Never did, never will. I've accepted that. Compression garments, as I said, not fun, not sexy, absolutely necessary. Flat knit compression is generally recommended over the round knit for lipedema because of how the tissue behaves. So getting properly fitted matters enormously. If you're poorly fitted, compression can cause more harm than good. So do it the right way if you're doing it. Exercise, the best exercise for lipedema is low impact, swimming. Aquatherapy, cycling, walking, rebounding, that mini trampoline thing, and vibration plates. So these support lymphatic drainage without creating that kind of impact that can worsen symptoms, right? It's not exercise for weight loss. It's exercise for lymphatic movement. So add that to your 24-hour day. Diet. There's growing evidence that anti-inflammatory diets, specifically low-carb and ketogenic approaches, can help reduce lipedema symptoms and slow progression. Not because lipedema fat responds to calorie restriction, but because the inflammation is a core component of the disease, right? So I've talked about the RAD diet because I've been on it many times. It's rare adipose disorder diet or rare adipose disease diet, RAD. It was specifically developed with lipedema in mind. There are also surgical options, tumescent liposuction, specifically water jet assisted or vasoliposuction, performed by a surgeon trained in lipedema treatment because you want that lymphatic sparing procedure done. So it doesn't affect your lymphatic system like surgery, especially rough and aggressive things like liposuction can affect your lymphatic system. But these are the most effective long-term interventions currently available. Okay, it's not cosmetic. It's debulking diseased tissue. Done correctly, it can dramatically reduce pain. It can improve mobility, and it can also slow progression. The key word, again, is trained specialists. This is not the same as standard cosmetic liposuction. Experience with lipedema tissue specifically matters. Insurance coverage for lipedema surgery in the U.S. is improving since the 2022 ICD code, but it's still inconsistent and often requires significant documentation and appeals. It's a pain in the ass. Many patients have traveled abroad. I know quite a few people have gone to Germany for treatment. That's where I'll be going if I decide I need another surgery. What doesn't work? Crash diets. Bariatric surgery alone, just pushing through pain with high impact exercise, ignoring it and hoping it goes away. None of these work. I've tried at least 3 of them. I'm not going to tell you which 3. There has been talk recently about tirzepatide helping with the inflammation part of it, but the research so far is anecdotal. And if you're someone like me who doesn't want to be tied to pharma for life, it's pretty tricky. I want to talk about something I think is underrepresented in the clinical conversation about lipedema, and that's what it does to you to find out. Not just the logistics, not just the treatment planning, but the moment or the series of moments when you sit with the information that your body wasn't a moral failing. The legs you hated and the body you fought against, and the weight that defined how other people treated you and maybe how you treated yourself. Some of that was a disease, an actual diagnosable named disease. That's not a simple moment. For some people, it's relief, pure and immediate, a name, a framework, a reason, right? An exhale after a very long held breath. But for other people, and I include myself in this, it's more complicated than that, There's grief in there. Grief for the years you spent hating yourself for something that wasn't entirely in your control. Grief for the medical care you didn't receive, the follow-up that never came, or the doctor who could have told you in 2000 and didn't. There's anger. There's a lot of anger directed at systems and at practitioners who gaslit you, and at cultural narratives that decided fat women's pain wasn't a priority. And I still have to pay fully out of pocket for all of my treatments in Canada, unless I want that needle for the rest of my life, which cures nothing anyway. And there's something else, something that's harder to name. It's kind of a renegotiation with your own history, because if part of what you carried wasn't your fault, what does that mean for the story you've been telling about yourself? Like, what do you do with a decade or 2 decades of self-blame when the foundation it was built on turns out to be false? I don't know. I don't have a clean answer to that. I think you do the work, therapy, if that's accessible to you, and journaling, maybe conversations with people who understand. Finding communities in the lipedema community online is genuinely remarkable. I have to say, people are doing exactly this renegotiation alongside you, right? And I think you practice something I call radical accuracy. It's not toxic positivity. I have no interest in telling you to love your disease or find the gift in your pain. That's disgusting. But accurate thinking, My legs are not a punishment. My body is not broken. I have a medical condition that was under-researched and underdiagnosed for decades. And I'm doing what I can with what I have. Right? That's different from everything happens for a reason. It's just facts, compassionate facts. Jacquie, I think your weight loss journey, the loss and the regain, deserves to be reread with this lens. Not because it changes everything, but because context matters. You were fighting a condition you may not have had a name for, and you kept going anyway. That's not a failure. That's extraordinary persistence in the face of incomplete information, right? Okay, so you've been very patient with me. We've done the science, we've done the grief, we've done the anger. Let's do the part where we acknowledge that living with a condition called lipedema, which sounds like it should be either a pasta or a pharmaceutical advertised with a soothing voiceover and footage of women in linen walking on beaches, has some genuinely absurd moments. So first, compression garments. I love them. I hate them. They are the control top pantyhose of the medical world, and putting them on in August is an experience I would not wish on a casual enemy. If you've ever tried to put on a knee-high medical compression stocking in a small bathroom while slightly damp from a shower, you've earned some kind of badge. I don't know what badge, but you've earned it. Maybe a very sweaty, frustrated badge. The second is the heat restriction. So I live in a body that is essentially doing a dramatic performance of, I cannot go to the beach. The legs have opinions about temperature, strong opinions, and they will express those opinions for the next 4 to 7 days. Also, I can't even bare my legs. Finding bottoms sometimes is difficult. And this whole skinny jeans phase that's been ongoing since 1997, can we just fucking stop? Like, even baggy boyfriend jeans take on that look with me depending on the day. It sucks. Third is explaining lipedema to people. There's a very particular conversation that goes, so it's not just water retention? No. Could you just elevate your legs? I mean, sure, but have you tried drinking more water? Oh my God, yes, I've tried water. Water and I have been acquainted for my entire life. We're old friends. Water is not the issue. And then there's my personal favorite, the people who tell you about a diet that cured someone's cousin. Look, I appreciate the impulse. The impulse is probably love, but lipedema tissue has never once in the history of the disease responded to a juice cleanse. I've checked. The literature is clear, okay? The dark humor is part of survival. I think it's how we keep moving sometimes, literally, when the moving is hard. If you live with a painful, chronic, often invisible condition, you're allowed to find it funny sometimes. You're allowed to make jokes about your own legs. You let your friends do it too. I've been called a butterfly with elephant legs. You're allowed to say my ankles have left the chat and mean it both literally and emotionally. Laugh when you can, cry when you need to, and for the love of all things pure and holy, let someone help you put on your compression stockings, okay? Here's what I want you to hold when you leave today. If you've been living in a body that doesn't make sense to you, lower body weight that won't move no matter what you do, pain in fatty tissue, easy bruising, swelling that worsens with heat, please talk to a doctor who knows what lipedema is. That last part matters. Seek out a practitioner with lipedema training. I've said this before. If you can just tell your doctor you want a referral to a vascular surgeon and don't say why, like just bypass your family doctor because they don't know what this is. And then just get right in with a vascular surgeon immediately. That'll help. Seek out these people who know what lipedema is. The Lipedema Foundation has a provider directory. The Fat Disorders Research Society is another resource. There are communities online full of people who will point you toward the right kind of care. If you're a doctor listening to this, I genuinely hope some of you are. Please learn about this condition. Please include it in your differential for women presenting with lower body pain and disproportionate fat distribution. Please do not tell your patient to just lose weight unless you've ruled this out first, okay? Every year of misdiagnosis is another year of preventable pain and progression. If you're someone who's spent years, like maybe decades like me, believing that your body was your fault and this episode has landed in your chest in a way that feels like recognition, I see you. I want to hear from you. I've been you. I am in some ways still you. You know, you deserve accurate information sooner. You deserve a follow-up appointment. You deserve a doctor who said, here's what this means and here's what we can do and here's what to watch for. You deserve that. I deserve that. It matters that you didn't get it, and it also matters that you kept going anyway. Jacquie, thank you for asking this one. Thank you for trusting me with it. I hope you feel a little more seen today. And for everyone else, take care of your legs. They're doing their best. I'll see you next time.
You've been listening to Unbound, Off Script. The script remains missing. Authorities have been notified. Beth Curry is clocking out, turning off the lights, and pretending she didn't just say all of that out loud. If you want her to do it again on a different topic, let us know. Until next time, stay curious, stay raw, keep it unbound. She's gone.